Hi, Sophia. It's been a while since I've seen you. How are you today?
Hi, Dr. Davis. I'm worried about my latest pap smear and colposcopy test results. Your nurse called me and said I need a procedure. After last year's abnormal results, I made sure to follow up this year, just like you said. But what's going on now?
I know it can be scary. Let me explain. Remember when you had your last pap smear? I told you that your results returned as LGSIL?
Yeah, I remember. That stood for low-grade something, right?
Exactly. LGSIL stands for low-grade squamous intraepithelial lesions. And your follow-up colposcopy showed that they were low-risk precancerous cells. Now, your most recent pap smear and colpo have shown that those low-grade lesions have developed into higher-risk cells. They're called HGSIL, which stands for high-grade squamous intraepithelial lesions.
Okay, so I had low-grade lesions, and now they've become high-grade lesions?
Yes, that's right.
Does that mean that I have cancer?
No. But if not treated, high-grade lesions have a higher risk of turning into cervical cancer. That's why it's so important that you followed up. Now it can be treated before it has a chance to turn into cancer.
Well, that's a relief. I'm glad we caught it before it became cancer. So what do I do now?
I'll schedule you for a short procedure called a LEAP. It stands for Loop Electrosurgical Excision Procedure. It's not very invasive, and you'll get numbing medicine injected into the cervix, so you're not in pain during the procedure. You may have some mild cramping after, like on your period. The whole procedure is done in my office. We should get that scheduled as soon as possible.
Sounds good. Thanks, Dr. Davis.
High-grade cervical lesions are on their way to cancer, so following up is the answer.